Hello, Chris. So nice to have you again. And today I'm very excited to talk about the topic is that you're an expert on, about the topic of public health, of human health, and how will this human health be in the creative society. And I know that you have your degrees in public health and that you have worked for a very long time, a decade or more, if I'm not mistaken, in this field of public health. So you've seen a lot, you have a lot of experience, and maybe some interesting stories to share with us. So yeah, please share how do you see the human health in a creative society?
Thank you. It's yes, my background's in public health. I've been doing this for about 10 years in different industries and different aspects or uh, types of public health and human health. Um, yeah, it's public health and human health is a very interesting topic. On the one aspect, human health is very dependent on our environment and on the functioning of certain environments and the functioning of wildlife and whatnot. But we've also created these kind of negative and deleterious situation in which we're constantly destroying primary forest and natural pristine wildlife in order to raise domestic animals. A lot of researchers and scientists believe that we can rebuild our forests with native trees and plants and whatnot, and get wildlife going again and whatnot. And we can do this in a way where we can properly feed all the people on this planet. Um, I don't have the numbers, on the top of my head right now, but I know we create a certain amount of food as a society. All the billions of people on this planet need a certain amount of food, and
Mm-hmm.
create more than we need. And the issue, so it's not about having we do have an abundance of good food. Problem is we waste so much of it. um,
I have heard stories, sorry to interrupt, I have heard stories and read out some articles, yeah, that like quite often that there is some leftover food in supermarkets or somewhere and it gets thrown away. So like the price doesn't drop or something. So yeah, it's like in our consumer society right now, people prefer to throw away food other than to give it to somebody who really needs it, or maybe homeless or just like, people who don't have enough money to buy all this stuff. So yeah, is that really situation? Is that is that what this overproduction of food is?
it's the whole chain. So it starts with farmers, where um, their practices, and especially larger Western society, we have monoculture where we have just fields, hectares or acres of one crop. And that right there is already an issue, because when you grow one crop in one area, you typically um, from a soil perspective, you're depleting all the minerals.
Mm-hmm.
When you have such a large field that you're taking care of, in terms of fertilizers and keeping the health of the soil up, is very difficult. And
Mm-hmm.
it's I have experience with working with soil and growing food organically, and I can tell you it's very difficult. Um, it doesn't need to be made difficult, but we do make it difficult. But when you grow like tomatoes, like in Northern California, the Central Valley, one of the main crops is tomatoes. So you just see acres and acres of tomatoes. And, these things are just growing on the ground, which means they're more vulnerable to infection and
Mm-hmm.
getting disease. Um, and the only way to prevent it, especially on such a large scale, is typically, if you're a small farmer, you use an integrated pest management system, or maybe you put certain flowers or herbs around your garden that prevent pests from
Mm-hmm.
getting around. Or maybe you make like a nice foliar spray that has some herbs on it, some essential oils in it, and that basically will deter pests from going on the plants also. And in general, just keeping the soil healthy and keeping
Hmm.
the plants healthy. They already should already have the ability to block pests from causing disease in their plants. They have their own natural defense mechanisms.
Hmm.
And these are just some of the ways to do this. But when you have a giant field of one crop like tomatoes, it's very difficult to do it, and so farmers often turn towards chemical poisons, that pesticides, herbicides, fungicides that you know do the job they're intended to do, but remain on the fruits and vegetables, and then we as society we consume them, which ends up just harming our health. So that's one part of it. So on the food chain, you start with this. You have already potentially an unhealthy food,
Yeah,
and
and again, I'm sorry, yeah, so because like why is this happening again? Why do farmers do this? Again, because in a consumer society, they're only interested in earning more money. Yeah, so they don't care about people, and they care about the quality of their food. They're not even looking for the ways to somehow like improve this. Yeah, so instead of trying to improve the quality and solving the problem, they would just to choose the cheaper way, and the cheaper ways, as you described, yeah, just using these poisonous substances that are also then affecting people's health. So again, we see that the problem, the problem here is in our thinking and our consumer thinking.
yeah, exactly. Yeah, so that's just the first part, is farmers and the way they do things. So there's food wasted at the farm because they don't always sell. If they grow X amount of tomatoes or they harvest X amount of tomatoes in the day, they don't, they only pick the best ones. And when you're
Mm-hmm.
harvesting, some get wasted, some are destroyed, but they ultimately, the buyers will only take the best looking ones. So then they make it to the grocery store, where then they're pretty much, they go through them again, and they can only put the prettiest ones on display in
Mm-hmm.
the grocery store because consumers don't typically want to buy anything short of a perfectly looking tomato.
Mm-hmm.
So then you've already lost a little more. And then people buy the food and perhaps they bought too much, or they let it go to waste. They didn't properly store it. So then you're wasting more food, or maybe a restaurant's purchased all this stuff and they don't utilize everything.
Mm-hmm.
They maybe use half a tomato. It's so there's all the way up and down the chain, there's a lot of waste. And that waste adds up. People buy food, they don't eat it, it goes to waste. And kind of one of the biggest issues, if I buy a tomato that was grown halfway across the world, you're now taking the natural energy resources from that farm, from that area, and now I'm putting it in a different location. And so that's the other big thing. We're taking all this energy, the mineral wealth and whatnot, the
Mm-hmm.
water from one part of the world where that farm was, and then taking it and putting it somewhere else. And maybe it's being utilized. You've eaten the whole tomato and it's nourishing your body, but maybe not. Maybe you've eaten half and you've thrown the other half out, put it into
Mm-hmm.
a trash bag. It's now made its way to the dump, and it no longer serves the purpose it was meant for. So a lot of food is wasted, and this, has a profound impact on our ability to feed people. I think right now with COVID-19, the mortality rate, I don't know what it's at currently, but I do know that every single day, children under the age of 5 are dying from hunger, and I want to say it's a couple thousand. It could be up to 8,000 a day. Children dying from hunger every single day, and yet we
We
don't.
have this waste, yeah.
Yeah, we don't. We're not stopping society for this. This doesn't get as much attention as it should, and yet we've shut down all society for something that is harming people and causing death. But right now, our public health system, the focus and the priorities of where we're putting our money and our attention isn't where it should be. In a creative society, this. As we described, the waste of food is kind of a function of our economic system, our priorities, and Mike, you said money,
Mm-hmm.
the almighty dollar. And in a creative society, the focus is on a healthier environment, a healthier human being, justice, health equity in a way, where even the poorest societies are able to feed themselves and have access to information on how to do this, how to farm, and then how to, what systems to use to distribute this in a way where everyone's getting everything and everyone's taken care of. Again, I always get back to educating at a young age, but in a creative society, we're teaching young individuals at a young age, you know, kind of spiritual health, mental health, as well as physical health.
Yeah, thank you so much. So interesting. And yeah, as I was listening to you, it was interesting to observe that many times you repeated that actually the problem is with our mindset. So even not so much, yeah, with like, the things in the material world, because yeah, it's like, when we talk about waste, for example, yeah, the waste of products, it feels like, yeah, we should, do something to our production, or something like this, just like, switch it somehow so the food is not wasted. Yeah, but now as you're speaking, I realize that there is also a lot of responsibility on us as consumers, because as you said, if we as consumers, we want only that perfect tomato, yeah, we don't, like everything else. So it's also like kind of our consumer attitude, yeah, that we only this want this, the perfect, the packaged and all that stuff. It also forces businesses to react to this in this way, and if it's like a little bit, not perfect as you said, yeah, to throw it away again. So it's also, the responsibility here is also on us as people, on everybody, to shift again. It's like, and not so much to shift in our habits, but like more like in our heads, that the things in the material world doesn't have to be perfect, yeah, that it has to be organic, it has to be good, it has to be good for our bodies, for our health. And yeah, it's not so much about the looks, funnily enough. And yeah, just to change this mental attitude, as it is, as you said, in different, yeah, in medicine, everywhere else. It's also like, yeah, in the medicine, as you said, the person already, it's like on one hand, the whole medicine, that is medical system that is currently existing, you mentioned it treats the disease already, yeah, but on the other hand, again, we as people, yeah, as the ones who consume this service, we tend to go to the doctor only when we already, have a disease. So also, we just common people, we're not so much interested in preventive care, in preventive medicine. So again, it's very interesting to listen to it, because you understand that you, as a just like regular human being, have this responsibility. And if every person changes this attitude in their mind, changes, these habits, then actually the world is going to change, because we as consumers, the majority, are going to dictate the new rules also for the businesses, right? So for example, if we are going to demand more preventive care and, different attitude from doctors, the doctors will have to give it to us. Yeah, same with like businesses. So yeah, it's very interesting how it all comes to our own responsibility.
Yeah, yeah, it does come, down to our own responsibility to take action, to kind of take the time to think about what we want as individuals for our own health and for the health of our friends and family, and and that of the community. It's always, people always say think globally but act locally, and it's a very important thing. When you have a new idea, when you have an image of your head of how your health should be, and what society's health should be, you think about it, you plan a course of action, and you start making moves. And it's important for people to do that. Not everybody's in a situation where they can do it, but for those that can, those people that have the time to do these things, to think about these things and act in their community, it's important for them to do it. No matter what age, young or old, when you have a new idea and you're ready to act, it's important for people to do that. And now is the time to do it. It's always the time to do it. Yesterday was the time.
Yes.
But hopefully, this COVID-19 pandemic is another big wake up call for people to take care of themselves, to hopefully realize, come to new realizations about themselves and about what society could be like, a more creative society, a healthier society. And hopefully going forward, this public health is given more attention. um, it's funny because already, come back to this, but celebrities are always given this, put on a pedestal, and very quickly it seems like, no one's thinking about them. They're not on top of our heads. The latest movies aren't coming out. Latest albums don't matter anymore. And so, I really hope people take stock of this and, major and more sustainable, influential, and healthier change is made, at the individual level, the community, at every level.
Thank you so much. I liked how you said it about the system, yeah, the medical system, yeah, that the first it all starts with the idea, and then with some people making a choice to act differently, and then the whole society changes, more people are joining, and so on. And I just realized, but it's the same with creative society, yeah, because many people also, when we have these interviews, we talk about it. Many people ask, why do you do it? Yeah, many people say that it's impossible. Look at the world we're living in. What are you talking about? But yet, even yeah, with the example you mentioned, it all always starts with just an idea, in our head, with just a thought, just a desire from inside to change, to do something. And, when you have this idea, a really good idea, then more people get interested in it. And then you start thinking about it. And the more you think about it, just as you mentioned, the more you think about it, then you kind of start seeing in your head the plan of action. It just comes together, this whole plan. And more people get interested and more people are joining. And then what used to be just a thought becomes a reality, step by step. And yeah, it's very inspiring that we can see that it's like that in everything we do. It's just, it all starts with a thought and with a desire of people to change something. And then yeah, and then whenever we want to, we can change anything, and we can create really what we want, not what is offered to us or what was imposed on us.
Yeah, exactly. Thoughts, everything, new ideas are infectious. One person has it, and then, there's an experiment they did once where they showed a monkey. I can't remember which type of monkey. They showed him how to use a tool. Or no, maybe they didn't show him. The monkey started using a tool, and then a whole different kind of monkeys miles away, no way to communicate, all of a sudden, all at the same time, started doing the same thing. And then it just spread like wildfire throughout the primate kingdom. And they had no way of communicating with each other, no physical way of doing this. And however it happened, it was a collective consciousness. So, like you said, one thought can change everything.
Let's hope it's going to be the thought about creative society. And we together are going to create the world we all deserve and we all want. Thank you so much for our talk today.
Yep.
And
Thank you.
until next time.
Absolutely. Thank you.